Hello ladies and gentlemen, this is Dr. Haris, a graduate of dental surgery from Lahore. Today we'll talk about the nerve which controls our facial expressions, the nerve which carries the sensation of taste from our tongue, and the nerve which is the seventh cranial nerve, the facial nerve. Now, before we move on, let's discuss about the basic structure of the nerves. Now, every nerve has a small round to oval cell body, which is also called the soma. This has the nucleus inside it, the nucleolus inside it, and other subcellular organelles. And emerging from the cell body are the projections, which are known as the axons and the dendrons. Now, the cell bodies, when present in clusters, are known as nuclei and ganglia. In the central nervous system, this collection of cell bodies is known as the nuclei, and the peripheral nervous system it is known as the ganglia. Now, the facial nerve has three main nuclei. It has a motor nucleus, it has a parasympathetic nucleus, and it also has a sensory nucleus. The motor nucleus will control all the muscles. The parasympathetic nucleus controls the actions of the glands, that is, the submandibular salivary gland, the sublingual salivary gland, and the lacrimal gland, which produces the tears. And the gustatory nucleus, which is the sensory nucleus, it takes the sensation of taste from the anterior part of the tongue to the brain. Now, all these nuclei are present in a structure of brain which we call as the brain stem. Now, we'll move on to the course of the facial nerve, which is very important for the dental students. Now, we divide the course of the facial nerve into intracranial course and extracranial course, and first we'll discuss about the intracranial course. Now, the facial nerve arises from the brain stem as a motor root and a sensory root, and this enters into the internal acoustic meatus, as shown here in the highlighted portion. The intermediate nerve is the sensory root of the facial nerve. It is also known as nervus intermedius, and the motor root is represented here by the facial nerve. Now, from the internal acoustic meatus, the facial nerve will move inside the facial canal, which is represented here as a dotted line. Now, inside the facial canal, there are three very important events that take place. First of all, the motor and the sensory roots fuse, and the facial nerve continues as a single nerve. Secondly, the nerve swells to form the geniculate ganglion. And third, the nerve gives three branches. The first branch that is given off is given in the middle ear. It is given to the stapedius muscle. The second branch that is given is the greater petrosal nerve. Now, this nerve will supply the lacrimal glands and the salivary glands. And the third branch is the chorda tympani nerve, which supplies the anterior two-thirds of the tongue and carries the sensation of taste. From the facial canal, the nerve travels to the stylomastoid foramen and exits the cranial vault. Now, we'll talk about the extracranial course of the facial nerve. As soon as the nerve leaves or exits the cranium from the stylomastoid foramen, it gives off three branches. First, it supplies the posterior auricular muscle. Secondly, it supplies the stylohide muscle. And third, it supplies the posterior belly of digastric. Further, the nerve continues towards the parotid gland, but it does not innervate the parotid gland, and without innervating it, it gives off five motor terminal branches. And those branches are the temporal, the zygomatic, the buccal, marginal mandibular, and the cervical branch. And all of these branches supply different muscles of the facial expression. Now, we've talked about the course of the facial nerve, and now we will move on towards the clinical aspects that are related to the facial nerve. Now, in the clinical practice, we have to give local anesthetic for a variety of procedures. And if the local anesthetic is deposited in the wrong place, and the wrong place is the parotid gland, the local anesthetic will make the facial nerve numb, and this will cause Bell's palsy. Now, Bell's palsy is a temporary paralysis which is caused because of anesthetization of the facial nerve. And the symptoms, which are temporary, are that the patient is unable to close the eyes. And this happens because the muscles that blink the eye, they are no longer supplied by the facial nerve. The facial nerve cannot control them. Therefore, you cannot blink the eye. Secondly, there is drooping of the mouth. And this is again the same reason, that is the muscle that keeps the mouth in its proper position is deprived of its nerve supply. And therefore, there is drooping of the mouth and there is also drooping of the saliva. However, this condition is quite temporary and you just have to wait for about 30 to 45 minutes before this condition settles. So, this was all about the facial nerve. We have discussed its course, we have discussed its branches, its nuclei, the actions, and also the clinical aspect. So I hope you enjoyed this video. Give a thumbs up. Thank you very much.